Good morning and welcome to the November 2024 board meeting held in public of the NHS Sussex Integrated Care Board, or NHS Sussex as we prefer to call ourselves. My name is Stephen Lightfoot, I'm the chair of the board, and my role today is to lead us through today's agenda, and we're holding our meeting today in Billingshurst. Now, by way of introduction, I'd just like to remind everyone that this is a board meeting held in public and it is not a public meeting, which means that members of the public can attend the meeting as observers, but it also means that I will only be taking questions from board members during the meeting, although I will provide the opportunity for the board to answer any pre-submitted questions from the public on topics related to today's agenda before we close. I also need to make you aware that we're recording the meeting so we can publish the video on our website, so that the public, our stakeholders and staff can see how we perform our statutory responsibilities. Now, before we go any further, I'd just like to go around the table and ask everyone to introduce themselves with their name and their job role for the benefit of everyone watching us here today. So, as I said, my name is Stephen Lightfoot and I'm the chair of NHS Sussex. Alan.
Good morning, colleagues. I'm Andy Hill, Chief Executive.
Morning, I'm Louise Ansari, Deputy Chair of the Board and Chair of the Finance and Outcomes Committee.
Morning everybody, Alison Cannon, Chief Nursing Officer.
Good morning, I'm Joan Padmore. I'm the Chief Executive of Sussex Partnership NHS Foundation Trust and I'm here as the partner member for mental health.
Morning, Paul King, Non-Executive Director and Chair of Audit and Risk Management.
Good morning, Amy Dahlia, Chief Integration and Primary Care Officer.
Good morning, Rahul J, Non-Executive Director and Chair of the People and Digital Committee.
Good morning, James Ramsey, and I'm the Chief Medical Officer for NHS Sussex.
Good morning, I'm Alison Challenger, the Director of Public Health for West Sussex County Council and here representing Public Health.
Hello, I'm James Lowell, I'm the Chief Executive Officer for Queen Victoria Hospital.
Morning, I'm Andy Heaps, I'm the Deputy Chief Exec and the Co at University Hospital Sussex, and George Finley sends his apologies that he can't be with us today.
Thank you, Andy.
Good morning, I'm Steve Allmer. I'm the Acting Chief Executive for East Sussex Healthcare NHS Trust.
Morning everyone, I'm Mark Stainton, Director of Adult Social Care and Health with East Sussex County Council, and I'm the Adult Social Care Partner Member on the board.
Hello, I'm Monica Fletcher, Non-Exec Director of NHS Sussex.
Morning, I'm Hannah Hamilton, the Chief Finance Officer of NHS Sussex.
Good morning, I'm Ravi Rajan, General Practitioner, General Partner Member for NHS Sussex.
Good morning, Faustina Bayu, Non-Executive Director and Chair of the Remuneration Committee.
Good morning, Claudia Griffith, Chief Delivery and Strategy Officer for NHS Sussex.
Hello everyone, I'm Sue Marshall, Non-Executive Director and I chair the Quality and Patient Experience Committee.
Morning everyone, my name is Angela Stevenson, I'm the Chief Executive of Sussex Healthcare NHS Trust.
Morning all, Mark Smith, Chief People Officer for NHS Sussex.
Thank you, colleagues, and I think we should just also record a special warm welcome to Angela and Alison, who are deputising for other colleagues today, and also to James, Andy and Steve, who are here as presenters for the item on planned care 2.1 on the agenda. So, in terms of apologies, we've already heard from some of those in a way, but we've had apologies from Siobhan Melia, who's the NHS Trust Partner Member, and Angela, as I said, is deputising. We've had apologies from Caroline Vass, the Director of Public Health Partner Member, and Alison is deputising for her. We've also had apologies from Vince Clark, who's the Director of Children's Services Partner Member, but unfortunately no other deputies were available today, although we did ask. Having said that, I'm pleased to say that the board is quorate and therefore we can make decisions today. So if we could just record that in a minute, please, Kerry, that would be wonderful. So if we just quickly go through the items in the board pack, I'll use the page numbers just to guide us through that. Can I just check on page number 6, we have the register of interests. Can I just check if there are any new declarations of interest that are not recorded in the register or are relevant to today's agenda? Not seeing any that have been proposed, so on that basis, what I've also done is to consider the agenda today against the declarations, and my conclusion is that all of the interests are manageable and that we do not need to take any further mitigation. Can I just check that the board is content with that conclusion, that we can carry on with the meeting as planned? Yeah, I'm seeing consent there, so please record in the minutes again, Kerry, that the board is content that we proceed with no further mitigations on declarations. That takes us on to page number 12 of the pack. And the minutes of the last board meeting on the 25th of September. I want to just check if these are an accurate record of the last meeting on the 25th of September. Sue?
Just a point on 2.1, the first bullet point states that the committee met for the first time in its new format. Actually, the committee met for the last time in its previous format and will meet in its new format at its next meeting on the 4th of December.
Yeah, okay, so that's actually on page, just for the minute.
Page 16.
Page 16 of the minutes, then, Kerry. We just need to change 2.1 to Patient Experience Committee, because that was the name of the old committee, and then just change in that first sentence, the committee had met for the last time in its old format, rather than for the first time in its new format. So, with that minor change, were there any other corrections to the minutes? Can I take them as an accurate record? Yeah, I'm seeing nods around the table, so on that basis, we can just note that the draft minutes with that one change that Sue highlighted are approved. If we then move on to page number 27, we've got the minutes of the annual general meeting that we also held on the 25th of September. The way the governance on this works is that we're asked as the board to approve the draft minutes because obviously we won't be having another annual general meeting until September next year. But before I do ask the board for any comments on that, I would just like to thank more than 80 members of the public who joined our annual general meeting. There were members of the public, there were stakeholders, and there were also partners who joined us on the call. And also I'd like to thank my board colleagues who not only did presentations, we produced videos, but we also answered a whole series of questions both on chat and also online. So I thought that felt like a really positive and direct dialogue with the public. So thank you for everyone who was involved in that. But just coming back to the minutes themselves, on page number 27, can I just check that they're an accurate record? We've also captured the answers to all the public questions that were asked in public as well. Raghu?
Nothing, just a minor typo on the minutes. It's mid-downs instead of Wilderness, but it has in the minutes from the board meeting, but it's just that the general meetings come across as the old name.
Oh, sorry, right, yes. So we just need to correct Raghu's location, not as mid-down medical practice, but as the rules and values. Okay, so if we could just make that one small change, thank you. Were there any other thoughts on the minutes? Okay, on that basis, can I ask the board to approve them? Yeah, okay, thank you for that. And therefore, just record that in the minutes, please, Kerry, that the AGM minutes have been approved. And that takes us on to page number 44, and that's the action log. And what we've got in the action log are 5 actions that are being progressed, 6 actions that are proposed for closure. Can I just check that the board is content with that status update? Not seeing anyone raising any issues, so on that basis, let's record the action log as approved. And can I just ask if there are any other matters arising from our last meeting that have not been picked up either in the minutes or the actions that anyone wanted to raise? No? Okay, great. That means then we can move swiftly on to the first substantive item on the agenda, and that's the Chief Executive's report on page number 48 of the pack. And the question here is, what are the current issues that need to be highlighted for the board's attention? Adam, you're the Chief Executive. You can assume the board has read your report, but are there any additional updates or actions you'd like the board to take?
Sure, thank you, Stephen, and good morning, colleagues. So, a few things first of all. So, this is the standard report, which covers 4 main areas really: the NHS Sussex organisation updates, our system assurance and operational oversight, and also our system leadership role. There's a few things to highlight to board colleagues, and therefore I'm very happy to take questions. So first of all, let's also recognise that this is the first time we have now met in public, and our actual organisational change process has now concluded, which has been of itself not an unsubstantial thing to get right. And our staff have been incredible in terms of their ability to keep delivering their role when we had to remove a third of the organisation. So that's, I think, the first bit I think to just recognise. And for colleagues who were able to join the staff conference or were part of or seen the speeches and things we did at the staff conference, had overwhelmingly positive feedback from our staff about that, and we're really pleased to see that our staff are still engaging on the journey we're going on. Linked to that, it will come through the People and Digital Committee later, but we are really pleased with the results of our partner feedback and also our staff feedback of us as an organisation. We're not complacent, there are still areas to focus on, but I think if we compare ourselves to many other ICBs across the country, I think we can say that we're in a good place in terms of where our staff are at. We held a session with them yesterday to really highlight what the themes of the review were saying. And we're really clear this doesn't cut across the staff survey that we're still asking staff to complete as part of the annual process for that, but it has given us a real clear sense as to where we should tackle things quickly to therefore give staff some certainty going forward. The other key parts I think that are important to note as part of this, we've also been working very closely as part of the work that the government are looking forward in terms of the 10-year plan. And also last week we received a letter that described the evolving operational framework and model of the NHS going forward. And we will work as an executive team to therefore brief board colleagues in due course about what that looks like going forward. The other key areas that I'd like to highlight really are also some of the areas that I think we are very proud of in our system at the moment. So we are working well to mobilise the MSK model that will go live in a few weeks, and we're really pleased by the work of all the partners and how they're responding to that. In terms of our responsibility for health and qualities, the work we've done targeting 30,000 people regarding targeted lung health checks and able to diagnose 114 cancers at an early stage in a really, really positive development. It kind of does amplify to the board though, I think, the level of input we need to have to get a significant return in terms of where things are at. For a long time we've talked about the pressures for mental health, particularly for children and young people, and we're really pleased by the continued rollout of mental health workers in schools, and that's going live and going really positively. And the last bit, because often we can speak about dentistry in quite a negative sort of connotation. Now let's be really clear, there are still members of our community that are still struggling with access for it. But the work the team have done since you've taken the delegation of that to therefore improve access is quite significant, and my report highlights that. So overall, I think if we looked at it globally, I think we've got a position where I think we've finished our change programme, staff are with us, we've got to work really hard to get it done. We've got to engage now in the new government's 10-year plan and how we therefore respond to that collectively and how we evolve our respond to that. We've also got to be really clear about there is still a responsibility for delivery today, and we are overseeing all of our organisations for that. And lastly, I think we've got a lot of work that will come later in the agenda about how our system are working together to tackle our long-standing challenges, but also to make sure we've got a clinically and financially viable system for the future. So that's where we're at. Very happy to take any questions.
Great. Okay, well, thank you very much, Adam, and an excellent report which I think shows the breadth and the depth of the organisation's responsibility. And I think we should just also note our congratulations to Louise Ansari, who has been asked to co-chair one of the 10-year health vision working groups on behalf of the government, and chairing a group with Dame Emily Lawson. So thank you for that, and I believe that Amy Gallia is also involved in that work as well. So I think NHS Sussex is well represented. So let's move on to questions, but Louise, why don't you kick us off?
Thank you. Thanks for congratulating. I keep getting congratulated, but it's quite a hard job. But a real privilege to be working on that as well. So, Adam, thank you for your report. I've got two questions, if that's okay. So the first one is about the vaccination programme, and I can see that you're ensuring a personal focus on vaccination this winter. Are you confident that the measures you've set out are going to significantly increase the numbers of people vaccinated? Is there scope for more outreach as we did before COVID? So that's my first question. And
why don't we just pick that one up? And I think actually, Sue, you've got a supplementary question on that?
I was going to ask around, are we assured that we're getting the correct data? So some people may go to GP practices, to pharmacies. Are we assured that we're not double counting, or that we are getting the correct numbers?
Okay, so that's two questions in one for vaccination. But you've got a related question as well?
Another supplementary one, and that is about staff levels of, are we confident that our providers in the area are actually doing all they can to encourage staff with their uptake on vaccination?
Okay. Right, 3 in 1.
Okay, there we go. Right, so thank you for drawing out the personal focus. In the board seminar last month, I was very clear of what were my chief executive priorities and things I focused on. So let's just be really clear what they all are, if that's okay. Which one is discharge, one is elective recovery, one is vaccination, one is winter, one is mental health crisis pathways. and also, in the context of that, how we manage our financial position whilst delivering our strategy. So there are the things I think is important all colleagues know have more of my attention than other parts of the system. In that context, vaccinations, we have caught up in many of the areas where we have been lagging, particularly in RSV in older adults. However, I have been quite challenging of the whole system, including our team, about our preparedness for vaccinations going forward. So there are certain areas that I feel personally, that we seem to always be a bit behind other comparable groups. So in the context of COVID, flu and RSV, I think we are now confident of the delivery plan for all those areas for our community. There is always more we can do regarding outreach, and Amy and the team with James are looking very carefully about what are the particular population segments and what more should we be doing, if that makes sense, and where can we provide further pop-ups in those areas. So I'm confident that the recovery plan now gets us back to where a population size I would expect to be. I do think it's important that we all reflect about why we seem to always go a bit slower than other systems at the beginning, and I think there is always a requirement, I think, on this to go at pace. I am concerned about healthcare worker vaccination, both in the NHS and also in care, and I've been quite challenging through the Chief Executive Community and their Chief People Officers. I'm not assured by the delivery model that people have chosen in that context, and I've asked that Mark Smith works with all the CPOs what that therefore means and looks like. What do I mean by that? To vaccinate people who are hard-working and need it done, I think there should be a delivery model on-site where staff are at. I don't believe it should be something where we ask people to go elsewhere going forward. So what I've asked the team to do is to look at the areas that I think we are underperforming on, to come up with a further recovery plan regarding what our staff vaccination looks like. And I'm also questioning through the assurance meetings we'll hold with providers about the clinical leads of organisations. Do they actually think that is the right model for why we would vaccinate our staff? And if they do, I'd be really interested in understanding the data that proves asking staff to go somewhere else for it rather than doing it opportunistically on-site is the right thing to therefore do. There is a lot of vaccine hesitancy in Sussex that I hear about, but I can't really point to, frankly, what we're therefore doing to respond to that. So I've asked a recovery police to come back on the staff vaccinations, therefore be clear on that. To Sue's question about the data points, there is an issue regarding data flow about making sure that if a member of staff has had their vaccination in a GP practice, for example, does that carry through into the data? But let's also remember our staff predominantly are also our population as well. So getting that right, it's quite difficult to triangulate. So there's less likely a chance of a double count. There's a chance of under-reporting our staff vaccination figures because of that. But I'm still in the place of, I still think that is the responsibility of organisations to get their staff vaccinated. I think that's key. So that, I think, answers your question. And then Mon, just remind me of yours there.
You've answered it to Louise, it was about staff, thank you.
Great, okay, well thank you for that. So I think what I've heard is it's work in progress, but you guys have got a very clear focus.
Yeah.
Louise, does that work for you?
Absolutely, thank you. So I've got another question, if that's okay. To put you on the spot, Adam.
Oh, go on.
What's the most positive and the most negative piece of feedback you've heard from service users since the last meeting?
Okay, let's start with positive. So we have had significant compliments about the work that has been done in our mental health services, particularly for people managing crisis in the new integrated community model. And so the data looks really positive of what's actually happening, but we've had quite a lot of people that have said that the service that the Mental Health Trust are now offering feels very personalised, feels very centric, and frankly, it is, looking at all comparable data points, it's quite rare to actually get that level of feedback, which indicates, I think, things are going in the right direction for that. That's probably the first bit. So it's a privilege having this role, but I get to read every complaint that comes into this organisation, every MP inquiry, all those areas. Thematically, the main areas that people would still be complaining most about or concerned about is how long they are waiting. And how long they're waiting, particularly for their elective surgery and their elective procedures. But the one that probably has struck me the most in the last period we've met is really the concerns that many families are raising about the waits for neurodiversity assessment and also for treatment. So as part of that, we are now building together what could be the task force locally that responds to that. It is a national problem, but it's easy to say that it's also a local issue to deal with, if that makes sense. And therefore, how we can get a robust pathway that is truly across all agencies and not a health response to something which is a public sector duty to respond to is the clear thing to get right. As part of that, I met with the Chief Executive of local authorities who are very keen to have a multi-agency response to it, but I think it's important that we're really clear what does the evidence tell us, how do you therefore handle that, and what is the plan going forward. The team have been asked to provide a plan to me by the end of this calendar year about what that looks like, and I think we should therefore take that in public to the board, and what it therefore means. It is important to say there will be an NHS contribution, but there will need to be a wider public sector contribution to this too. So I think it's important we describe what we think is our responsibility and what we're doing to get it right elsewhere.
Thank you. Great, thank you for that. Paul, I think you had a question.
Yes, final paragraph up to page 49 where we talk about the percentage of staff who disclose disability, and that's significantly reduced in the unknown category. Am I right to infer from that actually that means more staff are actually declaring they have a disability? Which I think would be, if it was the case, it would be a very positive indicator of people being comfortable disclosing within the organisation. Being neurodivergent myself, I think that's a very positive indicator.
So thank you, Paul. And so first of all, this sits in the frame of all of our staff have reported, and you'll have seen it in the report that we've run to the People and Digital Committee, that they feel able to raise concerns more here, they feel able to be more who they are. We have a piece of work about how we are creating a wider allyship programme that I'm sure we'll discuss throughout today's agenda, which I think all other signals that people feel able to say who they are. Now, it's not uniform. We're pleased with the progress we're making, so yes, more are disclosing it, but still there are still quite a lot that aren't. So it's important that we also make it clear about how do people feel able to be themselves, say what they need, and do they always get it? Is it the key part? Yes, it is positive, but there is, as always in this, there is still more work to do to get it right.
Thank you.
Okay. Rahul.
Thank you, Chair. Just a question on the NHS Sussex Digital Data People's Panel. Good to see that that's maturing, and we covered this at the first PDC. But I have a question on how we leverage this group to help transform services across the system, as well as communicate those changes to the population, and whether you have any thoughts on that.
Yeah, thank you, Rahul. And both Alison and Amy in their sort of joint brief for this work really, really hard to make sure we're not just using it as a place where we kind of take things and therefore get feedback. This is a really, really vibrant panel. They really want to help drive forward the system changes. I find them quite challenging in a positive way to us about could we get our act together as an NHS about how we're therefore doing that. The clear part that I think we need to leverage their work is in, we've got more work now to do to be really clear on the collective digital and data strategy of all of our organisations, and to be really clear that that doing things separately is no longer going to be the answer. And they're quite challenging of us about how we would therefore do that. So I would see over the next 6 months, we're starting to work more closely with the panel to be really clear about what do they think are the best transformative moves that we should therefore be taking. And to be really quite clear about how we shape that forward. They're really challenging about things like digital poverty and how we therefore handle people from different characteristics and how they interact with services. So they're a really vibrant bunch, but I think we have to be really clear about how we can help them to do something with us. Myself and the chair have met about when we next describe the digital programme here at the board, we should maybe bring some panel along to also give their perspectives of how it feels versus how we might be describing it corporately to therefore get it right. But thank you for raising it, and also it's pretty important in public to say thank you to them. They're a great bunch that challenge and support as an equal measure.
That's great. Okay, I'll come to Sue and then I'll come to Mon.
Thanks. It might be a question for you, Adam, it might be for Mark, really. So on under 2.1, we talk about the organisational change programme, and it's formally completed now and has been managed successfully. I'm just wondering, and I know there was some health and wellbeing support put in for staff during the change programme, but I'm just wondering how we're going to ensure psychological safety for staff going forward, because it doesn't just end at the end of the programme.
So shall I put my first thoughts then hand over to you, Mark? Okay. So we've had all the data points and what the staff tell us indicate that people are starting to feel able to raise concerns. However, we've just done a restructure, and there is now what is the evolving operating model of the NHS going to look like. So that just raises anxiety with folk going forward. And what you see in all of the, in every journal related to this is that when another change is coming, people kind of close down in terms of giving their thoughts for fear of reprisal or recrimination. So we've asked Mark to work really closely as part of our culture group to therefore be really clear what that therefore means and looks like. And we're going to start to work through how the culture group can have direct involvement with our NEDs to therefore kind of say, how does that look going forward? All the things that we put in place up until now remain in place going forward. So all the employee assistance programme, the access to counselling, the access to support, all still sits there. But I think the key part now is making sure that as we work with the culture group, I think they will start to tell us things, maybe some uncomfortable things that we need to be clear about what else needs to be put in place to therefore manage things going forward. So on yesterday's webinar, we were talking about this, and I was really happy that somebody felt able to say, I'm not sure who they were talking about, but they said, in this organisation sometimes when people are very busy, they can be a bit rude. But I would say that that is something which people would have felt scared to say 2 or 3 years ago. So they were actually, and then we're like going, okay, how do we handle that? So I think we're starting to hear it, but once you start to hear it, like we have to also be seen to do something for it. First of all, it's the right thing to do, but secondarily, there's a credibility gap if we don't. So that's kind of the approach taken. But Mark, do you want to cover off the actual specifics of it?
Thank you, Adam. And I think so. We'll be taking it soon. It's through the Commission for Improving Lives Together programme. So this isn't a programme whereby we say this is what we're going to do and we never adapt and adopt or evolve it. It's something that we're continuously engaging colleagues upon as we go through that journey. And the reason for the webinar yesterday was being open and transparent as always as to this is what our colleagues have said, this is what our partners have said about us in our organisation, and therefore how should we tweak that programme. So we're not rigid to the programme that we signed off here at the end of May to say we can't possibly change it now because that's what we agreed at the board. We will adapt it to reflect it. We'll obviously take it through the correct governance routes of the culture group, ExCo and here. But we are listening to people constantly about what they would find most helpful. So, and as Adam said, people are continuing to raise things that they would like us to change.
Good. So a lot of work going on in that area, and I think particularly bear in mind this change affected every single member of staff across that's over 800 people in NHS Sussex. This has been huge. So Mon, I'll give you the opportunity to ask the last question, then we'll need to move on.
Lovely, thank you. This is probably to, I think it's probably to James, but I'll ask it through you because it's into your report, Adam. Just going back to the lung cancer checks, and I think you threw in a number when you were giving the giving your report, that it's not in the paper. How many people were actually screened to detect that number? I think you said there were X number of appointments, but I didn't quite hear that. And is that the rate that we would have expected detection? And just one more question perhaps to James around that false positives, any unintended consequences of this, because it's a great story, and if we want to do that in the future, this is fantastic. But were there any issues around the whole programme on unintended consequences?
So I'll do the first bit of the programme because obviously with the setup before James arrived and give James a view to give us a clinical view of the rates of return. So it's really positive, but the reality is to contact 30,000 people.
30,000, thank you.
And therefore we managed to diagnose 140. That's kind of that gives you a sense of it. Now for 114 people, we have profoundly changed their outcome, which is an amazing thing to have achieved. But it just gives a sense, I think, about the amount of work it therefore takes to get there. Now, comparing that against population segments we looked at, that would be in line with what you would expect in terms of the current kind of diagnosis rate that you would therefore get to. In terms of what went wrong or what could have gone better, it was the first time doing this with that community. And the community in Crawley are hugely vibrant in terms of their opinion, their view, how you work with them. But there is also quite a level of scepticism about an NHS thing, if that makes sense. So there was something quite powerful about this is emanating out of Crawley Hospital. That is a well-loved local asset, and also making sure that it was linked into all the communication channels that that the community respect and also trust, if that makes sense. So the work we did with faith leaders, with community sort of spokespeople, was really helpful in terms of also taking out the fear of it, because when it comes to cancer diagnosis, there is also a body of evidence that says that people prefer to not know the outcome rather than go forward, because the fear factor of actually getting a diagnosis and what it therefore means can be quite challenging. So we've learned a lot with them. It's kind of similar to Louise's question about the vaccination programme, because the key part for what our role is in our health inequalities or getting trust with our communities has to be through utilising the excellent skill of local leaders to help get our messages out in the way that can be heard and respected. So I think we had a bit of a top-down element at the beginning, had to unpick a little bit to make sure it felt linked to the community, and then I think then things started to come together really well. And describing the success stories is really quite important. So we have the video where one of those patients speaks about what that has meant for their life. So when someone sees that, it brings it to life quite well. So that's kind of the piece in that. But James, anything you wanted to add?
Yeah, so I'll come to your first point around the numbers of cancers diagnosed through the programme. The conversion rate is very similar to what was found in the national pilot sites and similar to what we're finding in programmes as they're being rolled out across the country. Unintended consequences, I think there's a number. The first is how we manage the incidental findings. This isn't just a screening programme that detects lung cancer, it detects other pulmonary pathologies, but also cardiac and other issues. And so there's something about how we manage those incidental findings. We're also detecting nodules through the programme which require surveillance. That creates anxiety within those cohorts of individuals, but also puts increased pressure on NHS services. I think there's also been impact on diagnostics and also downstream treatments once we have diagnosed. But I think I just want to end with the message that prior to this programme, 80% of lung cancers were diagnosed at stage 3 or stage 4, where the outcome for those individuals was incredibly poor, and prognosis was poor. 80% of lung cancers now being diagnosed through this programme are diagnosed at stage 1 and stage 2. So I think there's a really positive message to end on.
Thank you for your comprehensive responses.
Yeah, thank you. Thank you very much, James. And I think actually it's a really good example of how we as an integrated care board are investing in prevention. So this is exactly one of the government's main aims, but I think it's an example of what we're actually doing. Just before we just conclude this item, there's just one thing I just wanted to come back to on your report, Adam, and that was just about item 3.2 on the new NHS England operating model. I think, as you said, we got a letter last week with some further guidance from NHS England on that, and we're expecting further guidance on the operating model in the planning guidance that will come out hopefully before Christmas. I think it would be helpful to probably, when we've got all the information gathered, that maybe at our next board meeting we could maybe have a paper on just to really confirm what the impact on NHS Sussex is with any evolution of the NHS England operating model. On the face of it, it doesn't look to me as though it's fundamentally that different, but I think it's important that we just consider that in public when we've got all the facts. So I'd like to suggest that, if that's okay.
Yeah, I think it's really helpful, and I think it's pretty important that we consider the question I think we should probably pose, if you're happy with that, Chair, is we go back and look at what have we been told, what is it saying, and then what our gap analysis is for our organisation about our strategic commission responsibilities, how we oversee the contracts of our providers, and our role within that context, and actually that will give us a sense about how far away are we from that currently and what things have to happen differently going forward. It is my view as Chief Executive here that we're quite close to that model already, and it shouldn't feel that different to most of us, but there is something about what many people have said is can we make sure that all our interactions are value-adding and non-duplicative? And I think on the latter point, there is still more work that we can do as a system.
Yeah, I think that probably does make absolute sense. So, we're asked as a board to note the paper with thanks. I think it always gets sort of discussion, so thank you again, Adam, for the paper. Two actions then I think that come out of this particular paper. The first was a suggestion that we have a paper to the board on the multi-agency neurodiversity pathway and improvements to that. And we'll work out, went through to work out what the right timing is, but I think that feels like a good action. And the second one, the impact of the NHS operating model on NHS Sussex. So if they can be the two actions that we take on that item, that would be helpful. We can record those in the minutes, please. Kerry, that would be great.